coming back from Ecuador to the United States, and I suffered a massive heart attack. And through a series of events, had to go to hospital, and eventually ended up having open heart surgery to have a mitral valve replaced. And in the process of having the mitral valve replaced, it dislodged the plaque in my arteries, and some of that plaque lodged in my kidneys, and my kidneys shut down. And I was on dialysis for 10 months, three times a week, 4 hours a day. That was my life. At the time, I asked the people in dialysis, is there anything that I can do to reverse this? And I remember very clearly a nurse turning to me and saying, honey, this is your life for the next 30 years. But I don't accept no for an answer. And again, through a series of events, we went to, my wife and I at the time, went to conferences seeking a different alternative to resolve the kidney issue, which is where we ran into European Wellness and into you. And through that process and through the treatment I've received at European Wellness, I have, after 10 months, my nephrologist called me in and said, I don't know what you're doing, but it's working and you are off dialysis. And I have been off ever since.
So basically, Michael was a gentleman in the late 60s when he suffered a heart attack, a myocardial infarction, and the treatment unfortunately didn't go that well and smooth. He ended up with the surgery, and the surgical operation also didn't went smooth completely. It had complications. He had his valve replaced, and as a complication of the disease and unfortunate events during the medical procedures, he ended up with end-stage renal failure when both sides kidneys, the arteries, were basically blocked by the embolus, by the thrombus, which is dislodged from the heart intima. And Michael ended up being on the regular hemodialysis 3 times per week in a span of 10 months. And in the process of that, from what I know, you have done a stem cell treatment in California in between the hemodialysis, which also did not bring any noticeable results in terms of the renal function.
Correct.
Right?
Correct.
And then when we met with Michael in the end of 2018, I have to say that he didn't look well. It was even difficult to walk, you know, the normal daily life activities were tremendously limited. And frankly speaking, even I had some doubts.
Yes.
Yep.
Yeah.
And I said to Michael, quite honestly, I said, let's not jump the guns, let's not use the heavy horses, right? Because we don't know whether the treatment, whether all the efforts that we're gonna put bring you some notable benefits. So we have tried with adjusting the lifestyle, adjusting the macro, micronutrients, proper supplements, peptide therapy, cell therapy with cell extracts, not the stem cells, but the subcellular products, organ-specific. We try for the couple of months, and we see if there is any slightest response in terms of your well-being, in terms of the function of the renal, kidney function, and the heart function. And when we saw that the first 2-3 months has started bringing some benefits in terms of the well-being and the improvement of the blood work, the blood's biochemistry, it sort of gave a hope, an indication that perhaps nothing is lost and something can be done. Because regenerative medicine, first of all, is identifying the trigger of the disease, the cause of the disease, and disabling the trigger of the disease. And then creating the optimal condition for the biological system which the person is to regenerate organs and tissues as much as possible. And on our side, we as practitioners, we only help and aid the intrinsic mechanisms in the body, regenerative, reparative mechanisms to sort of trying to trigger it and help the tissues to regenerate and repay itself as much as possible. Michael, it's been 6 years, right? How many stem cell treatments have you done?
This is well, for heart and kidneys, I believe this is my 5th time, 4th in EW clinics.
So 4 times with the EW and 5 times in total. And Michael, in your opinion, do you think that is it a specific medicinal product, one medicinal product that guarantees the success, or it's more like a proper approach and a participation of 2 people, the patient and the doctor, that brings the actual success to the treatment?
Knowing I was going to do this, I gave this some thought, and I want to make it very clear that this is not just a mechanical, and what I mean by that is it's just not taking something from outside of me, putting it inside of me, and making everything okay. This is a collaborative effort. It's something, you and I have known each other for a while. I trust you implicitly with my health and with obvious results. And it is a collaborative effort not only between us, but I want to mention this because I've done this interview before, it's also a collaborative effort between myself and my kidneys.
Right.
And this is one of the things that I learned in this process, is that when you have a part of your body that isn't functioning and it interferes with your life, the tendency is to become very angry, to become very upset because it's obstructing my life and limiting my life. And through a series of events, including plant medicine, shamanistic plant medicine, I came to realize that I need to treat my body and my organs, have a relationship with them the same as you and I have a relationship regarding my body, and treat them with kindness and with care and concern and support to support my return to as optimal health as I possibly can.
Right, right. And I have to say that Michael has always been a person who has been very supportive and during the treatment process, very supportive to me, to our entire team, and he was a very trusting person. He was trustworthy in terms of, we know that if we agree on something, on certain protocols, on certain lifestyle modifications, the type of activity that he is doing, I know that he will follow that strictly. And if he has any doubts or any changes that he wants to make, he will always call, he will ask, is it okay to do this, to do that? So we are in a constant understanding and sort of synchronized, yes. Although living in different parts of the world,
totally
meeting
different.
Sometimes once in 2 years, but still we are in sync. We're completely synchronized in terms of what he's doing on a daily life basis, in terms of the health management. I believe that's one of the major factors that contributed to the success. And speaking about success,
I agree.
This week we have received the latest blood work. 6 years ago, the GFR, glomerular filtration rate, was 9. At the time, Michael was on a regular hemodialysis with an end-stage renal failure. Then throughout the course of the treatment, managed to push it slowly to 11, to 19, then GFR became 21. Then subsequently, when the hemodialysis became only when necessary, and then he was off the hemodialysis, the numbers of the GFR that I remember were a couple of years ago were 29 to 31. And this week we have the result of GFR 45, which generally brings about 80% of the kidney function reversal, and it's pretty remarkable. It's pretty remarkable. Throughout the 6 years, Michael also became 6 years older, and
unfortunately,
which is
can't do it all.
You can't undo it. It's pretty much irreversible in terms of the numbers. And unfortunately, his heart, which has suffered a lot 6 years ago with a heart attack, myocardial infarction, surgery, valve replacement, is also not getting younger. So once in a while, it keeps on reminding Michael about its problems here. So this time he came to improve the heart function, not only the kidney function, which is more or less stabilized now, but the heart function, unfortunately, keeps on giving us some unpleasant surprises in terms of the rhythm and all, and we're fighting it. And this time we have changed some medications in terms of the cardiological management. We're working closely with a professor in cardiology, and she's giving us recommendations and advices on adjustment of this treatment. Michael, 1 week ago I told you that apart from the biologicals, apart from the regenerative medicine treatment, we're gonna do changes in terms of the medicinal approach as well. And Michael accepted that well. So what I'm trying to say is that modern medicine and the medicine that we're gonna have tomorrow in future, it should not be a medicine that will emphasize only on the conventional or alternative approaches. I believe that it has to be a holistic approach. It has to be a combination of regen medicine, translational medicine, straight from the petri dish into the clinical application, plus the conventional treatment, which we acquire or establish through the evidence-based medicine approach, which is a common standards in the modern medicine now. And I'm also very grateful to Michael that he has been a very open-minded patient who takes it well. Michael has been a very helpful and supportive and rational person. Plus, he is trusting because he knows that whatever we offer is safe. So the safety is the number one criteria when we come to creating the protocols of treatment.
Well, there's something that you said, and I guess one of the questions you watching might have is, well, why do I keep coming back? Not just because of my physical state, but why do I keep coming back to EW? And the reason is precisely what you said. It's evidence-based, that we work in collaboration, that it is always a dialogue. It's not the doctor telling me what to do, but it becomes a teamwork or collaboration together. And through that, the evidence, I'm here, my GFR is 41.
45.
Sorry, 45, I'm not going to take anything away from it. And that's why I'm here, and that's why I keep coming back to EW. And in fact, I'm working on setting up an EW clinic in South America, in Ecuador, where I'm living now. That's how much I believe in this company and what they do, and in particularly what you do. And I appreciate it from the bottom of my heart. There are some procedures that cause a certain degree of discomfort. I'm not saying pain, it's just not comfortable. There are some that I love, the hyperbaric chamber, I never want to get out of, I just love being in there. But I think it's not just that, it's the staff that's here. It's that the people here are so caring and they are so generous and kind, and they attend to anything and everything that I need. They anticipate what I might need. They check in all the time. Are you okay? How are you doing? Very different than other medical experiences I've had in other places where they put you in a room and you're in an apparatus, and an hour later they came back and they say, okay, you're done. Here, it's the caring and the concern that I think helps the whole environment of growing and rejuvenating and getting better, which is what this is all about.
Michael, remember what did I tell you yesterday? How many years ahead are your kidneys looking forward to have? What was the number that I put?
How many?
Well, I said another 30 years perhaps.
Well, I hope
so.
In 30 years, I will come back to Malaysia and we will do another GFR, and it will be right
Absolutely, absolutely. And meanwhile, we are taking more emphasis on Michael's heart now,
Right.
because we want to stabilize the rhythm, the cardiac contractility and all. We have the plan for 1 month, for 2 months, for 3 months ahead. That's the immediate plan. In terms of the treatment and investigations that's supposed to be done, what's going to be after that and how is it going to be after that, we're yet to find out. After 3 months, after we finish this treatment course and do the relevant investigations. The last thing that I wanted to discuss, 7 years ago Michael had a valve replacement, and it's an organic valve. It's a porcine valve. And he was told that time that within term 8 to 10 years perhaps that valve has to be replaced. And that time, 8 to 10 years, is coming very soon. You know, it's going to be this year, next year. So far, clinically, frankly speaking, there are no signs that the valve is malfunctioning or failing. We're going to have the actual confirmation and the assessment of the valve's function in about a month time, when he will do the relevant investigation back at home. But what Michael has suggested is that since the valve is an organic material, could there be a possibility that biologicals, the cell therapy, stem cells, peptide therapy, would also somehow help to support the function of the heart, of the valve, of the graft, and its status, its functionality? That's another thing for us to find out. The main thing ultimately is not chasing the parameters in the blood report. It's not chasing the numbers in the medical reports or any investigations. The main purpose is the well-being, to have a good quality of life, to be able to enjoy life, yeah? To be able to bring joy to yourself and to your loved ones. And I would also like to add on my side that Michael's story has, I mentioned that Michael is a patient, friend, and inspiration. Michael's story has inspired medical practitioners, and Michael's story has inspired some patients with CKD, with a chronic kidney disease, to search and look for alternatives and try to recover, reverse their renal function. Unfortunately, kidney failure, chronic kidney disease, has got multiple etiological factors. Cell therapy, regenerative medicine does not work equally well for all types of the CKD. For instance, if it's the autoimmune condition, or if it's a young patient with essential hypertension, the hypertensive kidney failure would not respond to cell therapy, stem cells, and regenerative medicine, as well as kidney failure in Michael's case, just because of the mechanism of the disease. Completely different, a totally different mechanism of disease. But being inspired by Michael's case, we had a few patients, around 6 patients, not with the end-stage renal failure, but the CKD varied from stage 3A to stage 4. And we had downstaging up to 2 stages in other patients. So with all that being said, we're still very, very selective in terms of whom this can be offered, because giving a false hope is not the right idea. Yeah, but understanding the mechanism, how the disease develops, understanding what are the triggers, disabling the triggers of the disease, and trying as much as possible to harness and increase the reparation, the regenerative potential of the tissues. That's what regenerative medicine is all about. Michael, thank you very much. Thank you very much for this journey, for these 6 years. Thank you very much for staying alive, for being well. Thank you very much for this wonderful smile. Okay?
All right.
Thank you and God bless. And I'm looking forward, really looking forward coming and opening a center in Ecuador.
Great.
God bless. Thank you very much.
Thank you all.
Thank you.